Dear colleagues and friends, Assalamu alaikum. Good evening, good afternoon, and good morning, and most welcome in another webinar on the series of webinars that GHD EMPHNET used to do over the last 2 years. And in today's session, we will talk about how the digital era has dramatically changed the way we exchange and transfer knowledge. For the last decade, internet has become a social sphere where communities can create and disseminate knowledge and information to others. Access to the internet has influenced the phenomena of knowledge transfer as a product through different mediums and technologies. Access to information and knowledge using digital means has become fundamental for education, development, as well as health. In the field of health, knowledge transfer has been an essential requirement for improving the quality of healthcare, research, and the quality of life in a region where the population has not yet reached a high level of economic and social development like our area, the Eastern Mediterranean region. In the past couple of years, and especially in light of the COVID-19 pandemic, the importance of knowledge sharing using digital means has increased in urgency, popularity, and significance globally. This was an inevitable development brought on by the lack of mobility associated with the pandemic. During this period, the digital sphere was the easiest way to reach information and to disseminate health knowledge and education through different mediums. It was especially realized that public health professionals, researchers, and students need a space where they can access concrete information through digital resources while sitting in one place. And this is where the significance of digital libraries increased. The world is also evolving towards open access, which encourages the research potential of the developing world. The phenomenon offers a practical response to lofty subscription fees to resources, which in turn fuels a disparity between researchers in developing and developed world. Thus, open access to information has the ability to reduce this inequality by making academic research available to all. All these issues will be discussed further in this session titled The Transfer of Knowledge in the Digital Age and the Increased Significance of E-Libraries. Before we have 4 distinguished speakers that are going to cover different angles of this important topic indeed. Just to attract the attention of you colleagues and friends, if you have any question, please put it in the Q&A box in the lower part of the screen. And hopefully we are going to address all of them later during the question and answer time. Allow me now to introduce my co-facilitator, Ms. Dana Shalaby. And Ms. Dana is the team leader for the Knowledge Exchange and Networking team at GHD EMPHNET. She oversees the development of initiatives that offer spaces for expanding the organization's networks. Ms. Shalaby has over 19 years of experience in communications, public relations, writing, and translation. She had worked in some of the region's reputable advertising and public relation agencies, where she took on several roles related to creative copywriting and corporate communications. Ms. Shalaby holds a master's degree in business administration with a concentration in marketing and a BA in English and comparative literature, which she had obtained from the American University in Cairo. Now we will go to Ms. Dana to introduce the first speaker, our distinguished colleague, Dr. Najib Shorbaji. Please, Dr. Dana, the floor is yours.
Thank you, Dr. Faris, for this introduction. And now it is my pleasure to introduce the first speaker we have with us today. Our first speaker for the evening is Dr. Najib Shorbaji. Dr. Shorbaji is the president of the Jordan Library and Information Association, the eHealth Development Association, Jordan, and the North Africa and Middle East Health Informatics Association. Dr. Shorbaji has been working as a consultant in eHealth, health information systems, knowledge management, medical librarianship, and electronic publishing since 2015. He is a member of the Scientific Council of the International Academy of Public Health and chair of the Specialized Committee on Development of Health Informatics Curriculum. He is also the chief editor of the Jordanian Journal of Library and Information Science. He is a member of the editorial board of other international journals and a peer reviewer of several scientific journals. Today, he will be presenting about the increased significance of open access libraries in forwarding health informatics. Dr. Shorbaji, the floor is yours. You have 20 minutes to present.
Thank you. Thank you very much indeed, Dr. Faris, and thank you very much, Mrs. Dana, for this very kind introduction. And let me first of all congratulate the EMPHNET for this great initiative of developing this electronic health library, which I think will make a lot of difference in the area of access to information. And the topic that I will be talking about over the coming 20 minutes is actually related to open access and its impact on access to information, knowledge, and the impact on libraries in particular. Now, this topic has been one of the most discussed and most researched subjects, because there is between brackets a tension between having an open access and commercial access through subscription. And what we can see actually among many of our publishing agencies is actually that they are tending to open access because they think that is a way that it will go. And from the point of view of trying to democratize access to knowledge, which means actually that knowledge for all, especially in health, the best way to go forward is actually to make it unprotected by walls of payment, and of course protected in terms of the copyright and the rest of the intellectual property rights that we have. Now, the move by the East Mediterranean Public Health Network to create this virtual library or this electronic library is very much needed and supported. And I have to say that it is actually very much needed. And I was hoping to see it for a long time, but now is the right time for its development and of its sustainability. So congratulations to colleagues who have been working on that, and congratulations to public health professionals and epidemiologists that will be using the library. So as I said, I will be talking about the impact of open access on public health practices and research. Before that, I want to ask the question, what do people do with the information? What do they do? If you have an information, you can apply it if you are a practitioner. You may create that knowledge if you are a researcher. You may transfer that knowledge if you are an educator. You may organize that knowledge if you are an information manager. You can have it online or offline, both ways. Online does not really mean, or offline does not really mean that it has to be in the internet or digital or whatever, but the different modes are being used. Printed versus digital, you can have it. Of course, you can have it multimedia, you can have it in different forms. But what you do is what we describe as the knowledge cycle in terms of creating and organizing and transferring and applying knowledge. And application of knowledge is actually one major component of what this particular network, the EMPHNET, is trying to apply. The use of knowledge and its application is so important, and it's essential for making knowledge, the generation of it and its utilization, and of course its transfer meaningful. So this is, generally speaking, what people do with the information or with the knowledge that they have. Now, health sciences has been actually one of the big topics that actually takes a huge part of the publishing process or accessing to knowledge. The internet has been one of the major components in terms of storing information or knowledge, and then its communication. And those who are dealing with generation and using information include a number of bodies, including professional societies and associations, the academic institutions, including the universities and research centers, There are non-profit making organizations, including the NGOs and the society, the community participation type of institutions. And then there is the public institutions, the government and semi-government institutions, and of course the commercial publishers and the commercial entities who are using the information for producing either products or for the use of that information to generate income or to generate something. Many of the publishers, as we know them, they don't really care a huge care about the quality of information. The most important for them is actually to make sure that the information is being published and being used by people. Now, the health science journals on the internet is one big issue that we need to discuss. The internet has fundamentally changed the practical and economic realities of distributing scientific knowledge and cultural knowledge, and that has been taken from the Berlin Declaration that was created in 2003. And the Berlin Declaration is, if you look at it, actually it has been evolved into adoption by the European community and by many others in terms of transferring the government into digital or e-government. The internet as a tool for publishing and communication has been in use since the creation of the internet itself, especially that the internet is an information management tool, whether we like it or not. Of course, it can be used in a good sense, and it has been used in a very bad sense, disseminating misinformation and disseminating information that is not really of high quality or of any quality. The web, we know it as one of the applications of the internet, along with the email, along with social media, along with the different aspects of the internet, which is a major tool for publishing the journals. And over 20 years or so, there was very few medical journals on the web. If we look at the chronicle trajectory of journal publishing on the internet or on the web, we will see that only in the 20 years of existence of the internet, there has been an increased number of journal publishing. So there wasn't much actually before that, but now, of course, the internet has become the mode of communication and the mode of storage and the mode of publishing of health sciences in this particular area. Now, what do we mean by open access? What do we mean? The open access literature is a digital one. It goes without saying. It's an online, and it is free of charge, and it is free of most of copyright and licensing restrictions. When I say most of copyright, that does not mean all copyright things. One thing that is extremely important is to recognize the value of this literature that is using open access or open free access to make sure that we give credit to people who do actually contribute to that. There are two primary vehicles for delivering open access to research articles. One is called the archives or repositories, which do not perform, that is no peer review, but simply make their contents available free to the whole world. So people actually put their publications or intended publications for peer review, quote unquote, by a huge number of people. The main target of that is actually their attempt to make the information, the knowledge available, regardless of the quality. And that by itself is very dangerous, because without peer review, without the limitations that we put as publishers on some of what has been published, it becomes open for everybody to do that. But at the same time, people do put in the repositories just before they start the peer review process, publishing in open access journals or in commercial journals. The other type is actually the open access journals, which perform a total peer review and then make the approval on that, and they approve the content freely available to the world, which means actually that the quality control mechanism in the open access journals is practiced in exactly the same way as the commercial journals. Now, some of the journals, some of the publishers of open access, they do not practice this particular review process, which means actually they are infringing on the quality of that, on the targeting only the commercial part, which is making money out of that. Open access is divided into two things, actually, or more if you like. Green open access, where accepted authors' manuscripts or other pre-publication versions are deposited in institutional and or subject repositories. So this means actually that the manuscript is accepted, so it is actually put in the repository. The gold open access, where payment for publication is made by the author's institution, the research funder, or another source of author-sided fund, so that the resulting paper can be read by anyone, anywhere, without any requirement to pay for access. And this is the major difference between open access and the commercial access. So in both cases, there is somebody that is paying. That payment either is done by the author or author institution or the research funding authority or somebody else, while in the publishing, while the commercial publishing, the access to the journal is made actually through the payment that is made through the library, the subscription itself. So we do pay this agency, for example, Shakespeare or Pergamon or else, despite the fact they do have actually open access. They started some of the journals. Now it is up to the library, it is up to the researcher to choose which journal that they would like to use. If the library has a lot of money and they have a lot of funds, they might do subscriptions to journals. If they don't have any money, then the best way to go for accessing knowledge is through the open access, whether it's gold or the green. Now, the published gold open access papers can generally be deposited in an institutional or a subject repository, which means actually you remove the version that was not edited, that was not peer-reviewed, which was done pre-publication by the one that is actually peer-reviewed and approved. The open access is actually provides free public access to publicly funded research. So if there is a research that is funded publicly by the National Institute of Health, for example, or by Gates Foundation, or by Wellcome Trust, or by any of those, now in the Arab world, actually, we have a lot of research that is funded by the public, including the government. Yeah, so that is to be put in the open access mode. The right to reuse the research is a relatively unrestricted way, as long as the source is attributed. Source is attributed means simply that we do say we have taken this sentence or this paragraph or this figure from this author, regardless of being open access or commercial. This is what is called the copyright. This is the intellectual property. So whether you are using open access or limited access, commercial access, you have to provide attribute. You have to say that this thing was taken from this particular author, which gives credit to the author himself or herself for printing or for publishing this thing. The work is published with a machine-readable license, of course. The work is deposited in an online repository using suitable technical standard for long-term archival. Now, the ORCID and the OI, or the digital object identifier, are being used for the article, which means actually that this is a permanent tag that is provided in a standard way to the article, which means actually the moment you publish the article, it is actually getting that particular thing. The traditional journal publishing model is actually the readers or their institutions must pay. That's the biggest difference. They must pay to access or subscribe to the journal articles. Then as a library staff, as a librarian, as a researcher, you cannot access the content of the journal. Of course, you can, if somebody provides it to you, or somebody is quote unquote stealing it or whatever. But the standard way of getting access to the article, if it is published in the traditional journal publishing or the commercial, is to get subscription to that. This model often concerns an embargo period of 6 to 24 months, which means that embargo period is actually the time that is required to do the peer reviewing and the editing and the rest of that, after which authors are permitted to post peer review papers or copyrighted version. The author accepted, they accept Word files version of the article to a repository or a personal website if they are allowed to do that. And that has to be negotiated somehow between the different players. The open access journal publication model, under that particular model, the author or their institution or funding agency pays a publication charge. That charge can be zero, as article processing charge can be zero. They give it free of charge to some of the low and middle development countries, which allows for the final copyrighted version of the article to be published in PDF to be made available online immediately and free of charge. As I said, it can be zero, by which they waive completely the thing, or it can be a few thousand US dollars if you are publishing in an open access journal that is very well recognized, such as Nature or the some of the science, or despite the fact they do actually publish short articles, but they do charge a lot of them. The Public Library of Science also charges a lot of money. Now, of course, there is possibility to publish in what is called predatory journals, which means actually that they do charge you a lot of money, but they do not follow the standard in terms of peer reviewing and publishing ethics as we know it. And there are some countries actually that are their publishers are flourishing on that as a result of not peer reviewing. And many of you have probably noticed that the moment you send, or somebody from your colleagues send the article for publishing, in the next day they tell you that it has been published, and you pay 1,000 or 2,000 or whatever thousand US dollar. The traditional versus open access, it includes the cost, the access, the reuse, the archive in public repository, or for example, the PubMed, and the copyright issue. There is differences in all of these, the cost and access and reuse and all that. So you would like to, if you would like to note that it's possible to have free of charge, it's possible to have open access, it's possible to reuse the content. So if you pay for that, then it is commercial. If you are restricted in terms of open versus closed access behind the payment walls, then it is actually you have to pay the cost. And the reuse, in both cases you are allowed to reuse, but in terms of the open access, you are not supposed to consult with the author. You just accredit that author and use it free of charge according to the copyright policy that is used. In most cases, actually, they put their what is called the licenses for Creative Commons. These Creative Commons are actually applied to commercial publishers, to government publishers, and the international publishers, but each one of them is totally different from the other in terms of the right to do so and reuse it. The advantages of open access archiving is that there is no charge on the future of the publisher, because they will continue to publish as before and is parallel with the open access archives. The very good example that we have is the archive free of charge services, which is an open access archive for over 2,000 scholarly articles in the fields of physics, mathematics, and so on. And this is the URL for that, which means actually that if you decide to deposit your article in that and it is accepted and the rest of it, then you are saying that I am giving away the right to gain money as a result of that. Of course, the intellectual property is always guaranteed. The material on this site are not peer reviewed, so as long as it makes sense to publish, you can publish, but you have to bear with the idea that X number, maybe 10, 20, 30, 50, 100,000 people will actually read this particular article and they are allowed to criticize it and to put their comments, which means actually simply that the peer review of that particular article is done by unlimited number of people. And unlike the commercial publishing model, where actually the maximum that you can do is probably 5 or 10 people who are reviewing the article. There are a number of advantages for open access archiving. That is no access, no charge for the authors, because they can continue to publish papers, their favorite journals. There is no change. They can continue to do that if they want. However, the impact of their work will be hugely increased if they also archive their full text publications in institutional archive using free software that allows incorporate interoperable searching across all archives, which means actually you are opening a window for the same authors to be seen, to be read by more people that might cite or that might see the publication. Now, if you are using the commercial publishing model only, it will be only those who subscribe to your journal that are having access to that particular article. Of course, the databases, the commercial databases, they do provide access to the research using the abstract, but not the full text of the paper. On the open access, you can have access to the whole article itself, which means that the people who are interested in that particular article can have better view, better reading, more time to read it, etc. The research output of the authors' institutes will be greatly enhanced through the establishment of an institutional open access archives, which means actually if you are having an institutional open archive, open access archives, that simply means that your institution is getting known and getting familiar to different people. That means actually that they are on the higher level of publishing and production of knowledge among the others. And as I know that for a fact that for example, in countries like Oman, like in Lebanon, in a number of countries, they do actually have open access repository archives. In the West, in Europe and in North America, in the United States, they do have that as an integral part of what they do as part of their knowledge sharing and knowledge communication institute. If the institutes are unable to set up their own institutional archives, authors may archive their already published research in any of the established archives. So if your institution is not an owner of that particular open access archives, then you can put that in an open access archives somewhere else. More and more archives are established, and more of the world research becomes internationally accessible for free. And this is what we would like to see in terms of access to knowledge. We would like to see more of those who are putting their research free of charge, accessible by people who need it. In Africa, in Asia, in Latin America, in those countries and these continents that they cannot afford to have subscriptions. Now the subscription itself is something that we do accept and we do recognize and we do encourage. But there are countries, there are individuals who might not belong to rich countries or rich institutions, or they do not have money to do that. And that's why it becomes more important for open access to disseminate the knowledge. Access to improved healthcare, even in developing and most inaccessible areas, is a basic human right. Now, one issue that is related to human rights is access to healthcare. Healthcare can be only improved if we have access to good knowledge, if that knowledge is available. There are many examples in Africa and in Asia and in Latin America and in many other places where healthcare is actually backward and hampered by lack of access to health knowledge. And in HIFA, for example, Health Information for All, there is enough evidence to say that the lack of information can kill people. Now, if we want to improve healthcare, then we have to improve access to information. And that's what the EMPHNET is trying to do, fortunately. all the 4 issues: international copyright, publishers' rights, authors, and local publishers play a combined role, which means actually that if you decide to have an open access, all these can come together to allow access to information by people. There is what is called hybrid journal publishing model, which means actually that you can have a paid and at the same time open access by other papers, and that is very selective. In some cases you sign the open access, and in other places you do sign the payment. Like for example, when I was in WHO, we did have an agreement with a number of journals by which that all the authors of WHO worldwide will have their own publications in these journals available in open access, despite the fact that the journal itself is a commercial one. So if you are a WHO staff at that time, maybe now it's continuing, if you are a WHO staff, then whatever you publish in that particular journal, whether it's open access or closed access commercial, then your publication is open access. The case for open access was done in 2002 by the inaugural speech by Peter Suber, who actually said that none of the advantages of traditional scientific journals need to be sacrificed in order to provide free online access to scientific journal articles. We do not sacrifice. We say that people should have access to high quality information with the certain conditions. Now, these conditions are described as the 8 Ps. So each one has to be peer reviewed. In open access, there is professional quality, there is the prestige, there is the preservation, there is the intellectual property for each of the journals. We do not actually say that they should not profit, and on the contrary, a number of people are profiting from that. There is a price on on certain advertisements, and you can have printed version of the online open access if you decide to do so. So if you have enough money, you can actually print and distribute in printing. Now, the changes in research patterns have actually meant that people need the open access. The discoverability of open access content will continue to be the main challenge. The free recommender services are likely to favor links to freely available content, which means if you are a researcher, you would like actually people to refer you to something that you can read, you can access. And unless it is free of charge, then you have to pay, or you will be frustrated as a result of that. Researchers may be reluctant to comply with open access unless it is a funder requirement. Many of our authors, unfortunately, and researchers, they do not want to be in the open access, thinking that open access can actually compromise the quality, the piece that we are talking about, which simply means that this is not true. The true thing is that the open access should comply 100% with peer review, with no cost, of course, on the user, and the cost is actually be borne by the funding agency or by the institution or by whatever. The text mining will be a key benefit to open access for researchers, which means actually that the content of the article is actually accessible. Open access will simplify the information access picture for institutions with branches overseas. There is still a strong culture of mistrust and misunderstanding about open access amongst researchers. Communication with researchers and institutions about open access will be an important function for libraries. This is one thing that the libraries should really try to promote. Instead of dedicating the money to make subscription, of course, they can have the money to fund, for example, research itself, to fund publishing in open access journals. And my advice to libraries is not really to compromise, not to say we don't need the money, which has taken place in a number of countries because of open access. They say that the libraries do not have the money, they should not have the money. That is not right. That is not acceptable. The same money can be used for other purposes other than the subscriptions. The library may reduce its budget, although the extent to which to this will vary between countries and types of institution. The academic libraries are well placed to manage gold open access budget, although some support researchers in doing this directly. Open access funding will be harder to budget for than subscriptions because of uncertainties over researchers' publishing plans. Now, if you are a library and you have a budget of say 20 or 30 or whatever thousand or half a million, you know that the journal subscription to that particular entity will cost you X amount of money. So you know the annual budget. What you don't know is actually how much the researchers will publish and how much they will be charged, especially if you are in a country that is that is not low and middle income countries, or you are partnering with one of authors of these countries, which simply means that the money that is allocated for the library is getting a little bit less, but it has to be used for a good reason to support researchers and to support the access to journals, of course, and to support the idea of actually having a core journal of subscriptions parallel to the open access. The role of libraries in that open access will reduce the importance of libraries developing institutional collections, but key librarians' skill will still be required. This is great news to the librarians, because these are the only people who know the full-fledged good quality journals. They know the directory of open access journals. They know that the conditions for the publishing in that journals, including the prices that you have to pay, is in the hand of libraries. So the librarians are important component in this particular cycle, because they know of the direction that is taken and the quality of the publications. External discovery systems may be favored over the library catalog, which means actually if you have an open access, you would like to see the outside, what other people have published, rather than what you have inside your library. And today, while we were in the launch of this particular EE library, the focus was actually how can we improve, how can we increase the content of the library by making sure that it is inclusive of the publications from the region, rather than access to external databases, which simply means that I would like to include in my library whatever has been published in that particular subject, in addition, of course, to access. Libraries are well placed to, and in many cases already do, manage institutional repositories. It is the responsibility of the library, it is the responsibility of the IT section in that particular institution to help in building and managing that particular thing. Managing the metadata will be very important. Metadata is the data that describes the management, the knowledge product itself. Functions such as metadata management and the preservation are likely to be done on a web scale rather than on an institutional level, which means actually, especially for multi-sited institutions, for example, the EMPHNET, where you have 22 countries and you have counterparts in different countries. There is no harm actually of having each country to have its repository and its institutional repository, and then bringing together through a networking pattern. Individual library value will be judged on the quality for provision rather than on the breadth of the collection. So if the library is actually capable of accessing 1,000 things, accessing is much better than having inside its collection 500 or whatever. So access is actually the quality control. The provision of quality is important. The value will also be added by digitizing and making available unique collection. The libraries will increasingly need to work together, share functions and services, and this is important, and attention will shift from the library to the librarian. And this is really important, because the librarian is the one who will manage this whole thing the information professional in the is the library of the future. So instead of saying that this is a librarian, we say that this is an information professional that is taking care of the information management provision or approach in that particular institution. I think this is the last one. Thank you so much for your attention and for the time given to present. Thank you.
Thank you very much, Dr. Shurbaji, for your informative presentation. And now it is my pleasure to present the next two speakers. Today, we are doing something a little bit different. We have two speakers presenting together one presentation. So allow me to welcome Ms. Alice Haddadin and Mr. Ghais Salameh. Together, they will be presenting about the importance of electronic libraries in public health practice. Mrs. Alice Haddadin is the director of the Medical Library and the Educational Resource Center at the King Hussein Cancer Center since 2003. Before that, she was working in the Security Forces Hospital in Saudi Arabia for 15 years in the same field. As a graduate in library sciences, Mrs. Haddadin holds a TOT or Train the Trainer certification with a concentration on how to use databases and reference materials on conducting research for medical information, including PubMed, Hinari, UpToDate, and others. While Mr. Ghais Salameh is the head of the Electronic Library of Medicine, ILM, in Jordan. He is an experienced leader in the non-for-profit, public, and private sectors with a special focus on health education, and knowledge management. He also demonstrates a working track record in medical health libraries, research support, health education, public health, and healthcare professionals support. Mr. Salameh is an advisor to health and educational institutions on how to transform health education and to plan their continuing professional development programs. Our distinguished speakers together, the floor is yours. You have 20 minutes to present.
Thank you very much, Dana. First of all, I'd like to launch their electronic library.
Mr. Ghais, we cannot hear you.
Can you hear me now?
Yes, we can hear you now.
Okay. Let me repeat that. I'd first like to congratulate EMPHNET for the launch of the electronic library, which is an excellent milestone for the EMPHNET, as per the different milestones that EMPHNET is going through with the public health domain. And at the same time, we'd like to thank you from my behalf and Alice's behalf for inviting us for this first webinar. And
Mr. Ghais, still the voice is very low. Please, can you raise the volume?
Okay. I'll stick maybe to the laptop more. Okay. So is it clearer now?
It is clearer now. Yes, you can go ahead.
Great. So today our presentation, as you mentioned, is going to tackle the importance of digital libraries in public health practices. The presentation is going to be co-presented by myself and Alice, and it's going to be on two parts. The first part will include a snapshot about the change of libraries from the physical traditional method of libraries towards our current era of digital and electronic libraries. Alice has a very vast experience as a prominent medical librarian through the years, and she can definitely give us a snapshot about the journey from a traditional to digital library. Alice, the floor is yours. You can.
Thank you, Ghais, and really I'm happy that we are today to talk about importance of digital libraries in public health practice. My presentation will be about how library role have been changed by the time and the importance of electronic library in digital era. It was, the libraries are simple. It was culture and wealthy and power splendor, and it was instrument promoting cultural value and important center of scientific meeting. But nowadays, libraries provide access to various sources of knowledge assembled anywhere in the world, navigation in scientific world, and integration of knowledge, non-material source of information, informational support for user, and with high level information culture. What is a digital library? You know, digital library or electronic or visual, or that they are the same meaning, and it is, you know, it's the component or the fundamental of the digital library is content, technology, and user. So the digital libraries are organized collection of information resources and associate tools for creating, archiving, sharing, searching, and using information that can be accessed electronically. What about the importance of digital libraries? It's a bring library to user anytime, anywhere, or in any form. That means the user no need to go to visit library building. And also it's improve access and searching the information is always valuable, and also it will be updated. Also improving the quality of learning, teaching, and research, and it's improved preservations, easy to copy digital information without error, and it's wider access to larger use base. Library thus meet requirement of much larger population users, and also it save money that the library are more expensive because of the building and needs more stuff and also more maintenance. What's the goal? We'll talk about now the goal of digital health libraries. Libraries support the information needs to the user by selecting, acquiring high quality resources and tools that support clinical care research, delivering information, and by collaborating, educating, maintaining an expert and comprehensive service for locating and obtaining worldwide health medical information through use of global and local digital resources. We will talk about challenges for digital library. The first challenges we face is knowledge and resources management, also technological, and also provide more efficient and more flexible tools for transforming digital content to suit the needs of end users. And the most issues that we face, and I know that everybody faces, this is the financial issues, and also the lack of expertise or experience of information technology tools, including security, and also the service oriented. And the last one, it's addressing legal concern associated with access, copying, and dissemination of digital material. I would like also to thank Dr. Najib, because he said about that the medical library roles is the most important and cell need. So I want to also to mention about the medical library roles that it's helping healthcare professional access to the quality information to the decision to inform their decision, and also searching the resources available and that the information in a way that support the work of healthcare professional. And also she will take care about that we have those information updated and with the latest evidence. And the most important here that we deliver a training for how to search medical literature or how to help them in their publish and everything. Especially we need this one in with the time when the COVID-19 pandemic time. Really, it was help. And also we as we provide the patient with information about their own health. As an example, King Hussein Cancer Center, we have managed to have the point of health information for the patient on the different types of cancer, and was provided through pamphlet and also electronic. And this was really, it was, that the patient, when they come to the clinic, the coordinator that they can easily, or they can come to the library also. We help them to find how to access, and to see the information about their own health. Usually, but this is the last, about my, presentation, that the library usually provide a lot of resources, if it's free or subscribe. And one of the most important here, I put the PubMed, it's free and not free. And most of the people I know that of the user, or health worker, they know PubMed is free and also not free. The free that they can access it from anywhere, and they can get, free articles. And also it can be only, not free for the article, but if you subscribe our, any hospital or any institution, they have subscribed with another publisher, they can access. And also we have different, also free Midline Plus, and we have CNAL, but this is from, subscribe. And we, the global health free, plus we have, ILM, or Electronic Library of Medicine, Geography. We have also plus, include Hinari. And now we are happy that, we have a new library. It's called EAL, and public health. Okay, thank you. Now, I will give the talk to Ray to present about e-library and information for public health. Okay.
Thank you, Alice. Now we'll since Alice gave us a snapshot on how libraries has transformed from a physical traditional method into digital or electronic sphere, I will have a more dive towards how information specialists and libraries can be of an addition for public health practitioners and workforce. As you all may know, that the CDC has divided the 10 essential services of public health. One area of these essential services is to communicate effectively, to inform and educate. This area, I believe it's in the role of the librarians and library services. It's to some extent, some prominent researchers are considering librarians or information specialists as full members.
Mr. Ghaith, I'm sorry to interrupt, but we cannot hear you.
That's weird.
I don't know. Maybe you can raise.
Is this better?
This is better. Yes, please proceed.
This better. Okay, maybe the position towards my laptop. Now you can hear me well, isn't it? Yep. Okay, I'll continue. So I'll go back to the service areas. So I believe that the library work and the librarians and information specialists fits within this service area, which is communicate effectively to inform and educate people. And even to some researchers and prominent researchers are considering librarians as a full members of the public health workforce based on "We are all public health" slogan. So to talk more about the information for public health and why public health professionals need information, since public health workforce work in an ever-changing situations, such as emergency settings, disease outbreaks, and others. Hence, the need for rapid access to information to support critical decision making is a key component or pillar for the need of information. At the same time, and as you all know, that public health is a multidisciplinary field with a diverse workforce and variable job functions and often overlapping. This diversity requires ways to improve access and reduce barriers to needed information to cater those specific needs. At the same time, public health professionals has a unique information needs. These information needs differ than the clinicians or other medical or health information needs. So it's vital for the enhancement of their practice. So it's very important to tackle the need of the information for public health professionals. So to look more to how can the health librarian or the information specialist work with the public health workforce in order to enhance the need for information and to cater their needs. The American Medical Association, the MLA, classified different competencies that they think are basic for health libraries, and these falls within the work and information needs of the public health workforce. There's 9 needs. We'll go through them quickly and briefly. The first one is the clinical and medical information provision. As you know, basically it's related to evidence-based medicine or practices, real-time information searches, institutional decision-making. The second pillar is the reference and medical education. This is a very important pillar since information literacy, continuing professional education, in-person and virtual or remote reference services are much needed within the public health workforce. Informatics collaboration, as you all know now, the world is moving more towards the digital health, and there's a more need towards health informatics, biomedical informatics, clinical informatics, and other areas of health informatics. Also, the library management, and as was tackled by Alice, the role of the library has changed. So library management is now different. There's the need for electronic resources, collection development and management, technical services, outreach, and publicity. Also, the library role and health information specialist role could go beyond into the community through liaison, outreach, and inclusion. And this is very important to reach out to the community with instructions, continuing education, equity and inclusion, and information on ethics. When it comes to research, and as we know, and scholarly publishing, it's a very important also pillar since expert searching, reference, scholarly communications, writing skills, systematic review, citation management, copyright, and intellectual property are all important aspects of the researchers within public health. The last 3 pillars that were identified by the Medical Library Association were the patient support and advocacy, such as expert searching, knowledge brokerage, information literacy, healthcare policy support, policy development, etc. Web presence and scholarly communication. It's very important since we're moving forward from the towards the digital libraries. So a strong communication and technical support, website planning, marketing in that area is really important. And the final pillar is the data management through EMR compatibility, integration, data management, and web content management. All these pillars and competencies address not only traditional aspects, but emerging roles and skills, including but not limited to open access, publishing, and distance education. So this takes us to the what research says about digital libraries. According to a systematic review done by GEDA in 2021, it shows that health libraries are designed to assist healthcare professionals by providing up-to-date information resources. Research showed that health libraries and librarians have a significant role in shaping the information-seeking behavior of public health professionals. This is very important because I believe that the role or let's say the integration between the public health workforce or professionals who are working in the field, or whether in the healthcare setting, and between the librarians or information specialists is much needed, because to form an information seeking behavior. It's really important to have that form of interaction. The lack of digital library setting hinder the information seeking behavior. So as a conclusion, health libraries play a significant role in addressing the information needs of health professionals by facilitating access to information literacy training and electronic information resources. The topic of this webinar is the transfer of knowledge in the digital age. So it's really important to share our experience at ELM and KHCC during the COVID-19 crisis, where we digitally transferred all our training and library support to be online and did the digital transformation. On this slide, you can see that we have conducted a survey after we have done the digital transformation with our users. And all the results, the survey results, showed excellent or satisfactory results from the users about the digital transformation for training and library services. Although we faced a lot of challenges during the first period of the pandemic, because of technical or other issues, or even the acceptance of the users for digital transformation. But towards the end of the pandemic, or while we were through the pandemic, things were much better, and there was a lot of adoption for the digital transformation of library services. And the results showed it during this, while we are doing this survey. And actually, we adopted those digital transformed methods beyond or after the pandemic, which we're still using till this moment. And I believe doing this webinar now is part of how we are trying to digitally transform part of the training and the interaction between the health information specialist and the public health practitioners. Finally, we thought to share with you this video from the Health Education England on the knowledge and library services to show how information specialists and library services can be the gift of time. So I'll just, because the link is not working, I'll stop sharing here and I'll share the other website. So if you can bear with me. So, can you hear? All is well?
Yes.
In the NHS, we decisions to be guided by evidence. It's enshrined in the NHS Constitution. Luckily, there's no shortage of valuable evidence. In fact, there's more of it every day. Lots more. Studies and research papers, articles and statistics, a veritable forest of evidence. Right now, busy clinicians and busy managers are spending precious time sifting through this evidence. But research shows that knowledge and library specialists are best placed to do this work. When knowledge specialists integrate with local clinicians and managers, they take the heavy lifting out of finding the best evidence to support decision-making. Now, those NHS teams are freed up to put evidence to work, improving patient care, patient safety, and patient satisfaction, transforming the quality, effectiveness, and efficiency of the care we provide. In fact, the research also shows that knowledge and library services can bring a cost-benefit ratio of £2.40 for every pound invested. Looking through the lens of the findings from this international research, it looks very much as if our knowledge and library services generate a net annual economic benefit of £77 million for the NHS, plus the many additional benefits of NHS teams using better evidence. And here is the opportunity. By improving the ratio of librarians to healthcare staff, we can increase this figure from 77 million to £106 million per annum. Trust the evidence, invest in knowledge and library services, and give frontline teams the gift of time. Time which can be spent caring for and treating patients.
Yeah, that's it. I guess we're open later for questions or any comments. Thank you, guys.
Thank you, Ms. Alice and Mr. Ghaith, for this very informative presentation. And now it is my pleasure to present our third speaker for the evening, Dr. Ala Zain. Dr. Ala Zain is the director of the Medical Library and a lecturer at the American University in Beirut, AUB. And she is the first woman to hold a PhD in cell and molecular biology from AUB. Dr. Zain works on supporting medical research and improving the quality of health information and knowledge and research evidence to promote the dissemination of evidence-based information. She is the first country representative for Lebanon at Healthcare Information for All. She serves also as a committee member at the International Federation of Library Associations and Institutions, and was elected as a member of the Coordinating Committee of the American International Consortium of Academic Libraries. Dr. Ala will be presenting her experience in shifting research learning so that it is online. Dr. Ala, the floor is all yours. You have 20 minutes.
Good evening, everyone. Thank you, Dana. Can you see my slides, my screen in full screen? Okay, thank you.
Yes, we can.
Thank you. So I would like just to thank EMPHNET and Dr. Sherbashi for inviting me to be with you today. I would like also to thank the attendees for taking the time to be with us. And I hope we'll have a helpful session that to take it as a learning opportunity to reflect on a topic that I believe it affects each one of us in one way or another. So I'll be a bit more probably practical as my colleagues, and I'll try to walk you through what we did at the Medical Library at EUB throughout specifically the last 2 years. So no one can ignore that the pandemic has affected all of us during the past 2 years, and specifically the field of education, which has been affected drastically across the globe. Whether you're a faculty member, an IT person, an instructional designer, or a librarian, we've been all affected by this sudden transition from the face-to-face settings to going online, to teach, to learn, and to transfer knowledge. So being myself a faculty member for the past couple of years and now the director of the Medical Library, I found myself at a situation where the traditional model of knowledge transfer is no more applicable. So previously we used to go to our classes, help our students, explain what we need to do using probably some slides over PowerPoint or maybe the board, get instant feedback, grade, and that's it. But just over one night and with all the lockdowns and everything, the decisions, we found that this is no more possible. But we had to cope. We had to do this urgent transition. And remember, we had no time to learn and to know what we have to do and what's the best to do. So we had to work not only fast, but also to maintain the good quality of education that we used to provide for our users and for our students pre-pandemic. So these were all a lot of challenges, and every one of us from his position started to cope with this new normal and to apply as much as we know to keep the same good work level that we used to do. But we cannot ignore these challenges and questions that came to our mind. How to maintain the good quality of education, how to enhance the teaching experience, how to evaluate students, how to engage our students, how to continue to deliver our services at the library. So that was a big question. How to help our users, specifically that my users are in their healthcare settings, in the hospital and in the field. So what should we do? So what we did at the library to help in sustaining a good quality of medical and health education and to continue to provide services for our users online, whether they are in their classes or in their hospital for practical clinical training. So action had to start from day one, and we had to act very fast, as I said. One of the things that I would like to share with you is forming a medical education e-learning task force This was really mandatory back then, because due to this urgency, we can no more rely on our traditional way of doing our medical education. So we needed something to supplement and also to augment our traditional education while facing all these new expectations. As you can see, this task force has different stakeholders from different backgrounds. The associate deans, faculty members, IT, representatives of students, coordinators, course designers, but also myself representing the library. So what was our plan of action? We created 4 subcommittees in this MET. One had to do with computer-assisted learning. We can no more rely on the face-to-face, as I said. One has to do with mobile technologies and all these new ones. One has to do with simulation and augmented reality. That's now a reality and it's no more virtual. And the 4th has to do with the assessment and the e-portfolio. So what were our tools of action that we used? Being a librarian and a researcher, as I said, in the committee, so we conducted a lot of surveys, a lot of interviews. We conducted extensive literature reviews of what's happening, what can we do. We had a lot of weekly and even daily meetings for the committees. We had to map and see what resources we have and what needs we need in our different programs. So keeping all that in mind, we cannot ignore that we faced a lot of challenges, which I tried to classify at 3 different levels. One at the level of the resources, what type of resources, materials, and tools. The second is at the level of the pedagogy and active teaching and level of services that we need to provide. And the third is at the level of social and psychological instabilities. So,
pardon, Dr. Ayla, are you using the slides? Are you moving your slides or not?
yes, sure. From the
No,
beginning.
they are not. No, unfortunately, they are stuck in the first slide.
Oh, really? I've been moving them. I'm in slide 10. Oops. Uh-oh. I'll try to stop sharing probably and share again.
Yeah, that's fine, please.
Sorry. Okay, so how can I stop sharing? Yeah, thank you. I'm sorry for that. I thought you're following up. So I tried to share again. So, okay. Oops. Okay. So I think. Is this okay?
No, we prefer to have it in the full screen mode.
Yeah, I'm just. It used to be here, but I'm trying to get rid of this bar. Okay. Yeah, can you please, just to make it full screen. I just need to move that. Yeah, yeah, that's it. I think swap presenter. Yeah.
Yeah, perfect. Thank you.
Sorry, I'm very sorry for that. Okay, so I wouldn't go back to my slides. I hope it was catchy even without slides, but that was what I was covering. So for the first level, which I said the challenges at the level of resources and materials, the recommendations, I wouldn't walk you through the whole process, which was really extensive, but I'll share with you some of the recommendations that we came up with. So one of the recommendations, we agreed that I do a curation of these tools. Remember, back then, each one of us started to use simple tools like Zoom, like WebEx, or whatever was available. available. But then we started to hear about a lot of tools, Flipgrid, Padlet, Google Docs. What's better? What's best? What to use when doing what? So honestly, I started to get confused with all these tools and attending a lot of conferences and webinars about digital tools, because I wanted to present them in a way that not just listing for these tools, but also if someone wants to go as a librarian or as a student or as a faculty member to go and use one of the tools, I want them to use them according to why. So if you're interested in a lesson delivery tool, you can go and click on this tab where you will have a lot of sub-tabs. Unfortunately, due to time, I wouldn't be going through the details, but you're more than welcome to visit any of the guides that I will be talking about today. So you will see under lesson delivery tools, there are a lot of tools, depending whether you want it to be synchronous, to record, to do discussions, the same for communication tools, for assessment tools, for knowledge tools. So these are all organized, and you can see even if the tool is free or if it's paid or if it's just available. So this guide has been heavily used, and thankfully it has been received more than 3,000 views and uses, which I hope has been helpful for everyone to decide which of these digital tools that we cannot get rid out of them. Another recommendation was that I do a curation for teaching digital resources, because remember also again, our students and our users for the library are no more able to be physically present here. So how can they make use of the resources that they used to use physically by coming to the library? So what I did is a curation I called Resources for Med 1 and Med 2 students, where I tried to add all valuable resources electronically that they can access even from home. So all the books that they need, we even tried to work on the syllabi of some of the courses and to replace physical books with ebooks so that the users can make use of ebooks at the library. We have videos and multimedia because we can no more work without them. We have mobile apps, we have databases, electronic, that they can also access from home, and a lot of other resources that as also we don't have, unfortunately, enough time to go through them. So this is also another curation which has been received very helpfully by students. And also I'm currently working on a third curation which has to do with the augmented reality, 3D printing, simulation, and all these digital world that we have to adapt by it nowadays. The other level of challenges, what at the pedagogy, as I said, so even if you have the resource, what's the best way to deliver the material? Do you go for hybrid? Do you go for synchronous, asynchronous? So taking into account all that, the type of material, the time needed to prepare, the connectivity issues that we have in Lebanon, and engaging our users, we took a lot of recommendations. So we said that some faculty, depending on the material that they're doing, or librarians, they can continue to deliver their material using voice over PowerPoints. Others have to go for flipped classroom, but some have to come on site, on campus, and to deliver their classes synchronously. So we had some of our face-to-face courses, classes, and rotations. That's why we decided to open the medical library back in June 2020. So we only closed for 2 months, and we had to be here because the hospital is functioning. I would like also to mention that a lot of students and faculty and users who haven't been engaged in research, they started engaging in research and doing systematic reviews, and which, you know, I'm sure a lot of the audience, they are at the top level in the evidence pyramid. So they started involved in these, and which were also our go-to when we wanted to know any new medication, any new guideline for tackling the COVID-19 pandemic. So we couldn't take care of all that and forget the instabilities, whether at social or psychological instabilities, which unfortunately in Lebanon, we're still going through a lot in addition to the pandemic. So we had to help our users, even with their mental struggles, with their fears. That's why the library, as I receive from all of the users, we're also a social space for them, and not only a space to study and to learn, but also a social space for them to build in their social capital. We also had to change a lot of our evaluation criteria to keep our students engaged virtually, because it's not as easy as face-to-face settings. We also had to go to virtual office hours. So you might not be able to meet your users and your students face-to-face, but you have to provide a space virtually for them. So in addition to all that and the work of the library digitally with the task force, how did the library help in providing online teaching, research, and public services for our users? I know also the time is limited to go through a lot of details, but I would like only to share with you some numbers from 2021. I also skipped 2020 for the sake of time. So as you can see, we had really high numbers of services for our students. So we had approximately 500 chats, which is an online chat service like WhatsApp chat with our users. We have around 4,000 emails with our users who needed help, who needed a teaching resource, research resource. And you can see almost 60% of these emails come from the medical library only, where the users are always in urgent need. And as my colleagues presented, they usually in more need of health information and medical information. You can also see the one-to-one sessions for helping in their research projects, in their classes, and in their assignments. So we had more than 1,000 one-on-one sessions, of which 90% were done in the medical library also. The library is not only involved in public services, but also in delivering sessions, information literacy sessions, and courses. So if you see, I was able to give almost 100 classes for around 1,900 attendees, for almost 2,000 attendees during the year of 2021. I was able to teach more than 100 classes, and also to give around 850 one-on-one sessions. I can say 80% of these were really purely online. Without the user able to come to the library, we were able to provide the service online, whether it's a teaching, whether it's a research service for them. What about our collections? So first, I'd like to shed a light on some of the digitization initiatives that we have at EUB. So even prior to the pandemic, the library at EUB are leading a lot of digitizing initiatives to preserve this heritage, to disseminate information, and to make it reach the largest possible audience. We have different types of materials, whether books, manuscripts, photo collections, historic maps, and a lot that are being digitized in our labs. So usually we tend definitely to go for the in danger, the material that you are afraid of being lost, and that is rare, that is old, that are unique. And also, because of the pandemic and shifting online, we had also to digitize some of the new material, not only the old and the rare ones. So EUB is a part and partner of the ACO, the Arabic Collections Online Project, along with other universities like AUC, Columbia, New York University, Abu Dhabi, Princeton, Cornell, and others. This ACO aims to digitize, preserve, and provide free open access, as Dr. Shorbaji was mentioning about the importance of being free, to a wide variety of Arabic language books in different subjects. These are provided for you, for any user in the world, for free. You can just go and through them. Other examples which I'll provide are a bit more health related and medical. We have digitized all the annual reports from 1898 till 1978 of the Asfuriye. I'm not sure if you're familiar with the name. This refers to the Lebanon Hospital for the Insane. And we luckily have collected at EUB all the archive of the annual reports, and we have digitized them. Believe me, we have a lot of requests even from non-Lebanese people of worldwide who ask to have access to them. So we have them online, and they come also to visit physically to look at these archival materials as part of their research, their PhD theses and others. Another example is Kitab al-Qanun fi al-Tub for Ibn Sina, which dates back to 1593. We have it in our archive, both as English and Arabic languages. In addition to other books, I wouldn't also, for the sake of time, just mention a couple of them. Al-Misbah al-Waddah fi Sina'at al-Jarrah. This dates also back to 1873, and this is available in Arabic. This has been digitized and available in Arabic. Kitab al-Nabat, which is also a unique and rare one from 1258. This is also available in our archives. We have a Kitab Qanun al-Sahha for Hassanain Ziftawi. This is also available for us. Kitab Umdat al-Muhtaj fi al-Mayl Adwiya wal-Ilaj. This is considered like a guideline for sciences of medication and treatment, and this is also available for us. In addition to a lot of other books that has to do with different medical specialties. We also have luckily digitized a lot of medical journals like Ash-Shifa, which is different volumes that also date back to 1887. We have also digitized a lot of the volumes of this Journal of Medicine and Surgery. This has to do with both, and it used to be published on the 15th of every month. So we have it here. Another well-known medical journal, the Doctor, Al-Tabib in Arabic, which you might be all have heard the name. We also have it, which dates back to 1884, 1885 years. And we have it also digitized. The most recent...
Dr. Ola, I'm
Yes.
sorry to interrupt. Can I please ask you to wrap up in 2 minutes?
Yeah, sure. So the last initiative, thank you, Dana. The last initiative is the Lebanese Medical Journal, which we now have it fully open access and free from 1948 till 2019. In addition to other posters, letters, which are really unique for this, for our collection. Another initiative is the data management, which also Dr. Najib mentioned. We have our AUB Scholar Works, which is a digital service to collect, preserve, and distribute digital material. We have also AUB Data Bank, which is also a digital institutional repository, increases our preservation, visibility, and control. This is all clear and all examples that we are advocates for open access. We participate in the events of open access weeks, also open access publishing, whether as librarians. So this is one example of my publications, which is already published in Open Access Journal. We also are in support of open educational resources. So we have an initiative that we have started last year, and we are getting more into that. So I wouldn't take a lot of other time, but I would also like to say that the library had also a role beyond the walls of the library. So I tried to help also in giving awareness sessions about the pandemic when it all started. And we also started to give these sessions online. I've also worked on my COVID-19 resource center, which I like had been called by users as one-stop shop website for anyone, whether a public health professional, a public health consumer, or anyone. I hope you will be able to make use of it, which has been used by more than 500,000, 1,500,000 views till now. Unfortunately, not a lot of users from the Arab countries, only 2, UAE and Saudi Arabia, but luckily it has been distributed all over the other world. I would like also to shed the work that we are trying to do with the HIFA, Health Information for All, and thankfully to Dr. Shurbaji for connecting me and being the country representative. Also in IFLA, which we work a lot in educating the less vulnerable and providing evidence for global and disaster health. I continue my work also with Arab Ways, which is the Arab World Association of Young Scientists. I'll leave you just with 1 minute of key messages and recommendations. So I'd like all of us to advocate and engage for an open culture, not only open science, whether within our institutions or even citizens. We'd like to invest in open science infrastructures. I hope that we make open science a sustainable global reality by itself. I hope to aim to build connections and alliances with each other. So we try to link our science, our libraries, our information to our society. So as we try to do at EUB with all what's happening in Lebanon, to take these challenges as opportunities, I'd like all of us to take that as a motto and to be all open to share and receive knowledge. Thank you so much. I'm sorry if I took more of my time, but due to technical glitches, maybe it took. Thank you so much again, and I hope this was helpful.
Thank you so much, Dr. Ala, for sharing this experience. You gave us a lot to think about. And now allow me to introduce our last speaker for the evening, Ms. Miral Junaid. Ms. Miral Junaid is a networking officer within the Knowledge Exchange and Networking Unit at the Center of Excellence for Applied Epidemiology at GHD EMPHNET. She is also the library administrator of the recently launched EMPHNET electronic library. Within her role as library administrator, Ms. Junaid is in charge of feeding EEL, our EMPHNET electronic library, with resources, supporting users in accessing and using the resources, maintaining the digital portal, and promoting EEL and its services. She is also responsible for networking with other librarians and public health professionals to find more opportunities for knowledge exchange. Ms. Junaid graduated from the University of Jordan with a bachelor's degree in French language and literature. Ms. Miral, we will be introducing today the EMPHNET Electronic Library EEL, which was launched May 11. Ms. Miral, the floor is yours. You have 20 minutes to present.
Thank you so much. I just want to confirm, can you see my screen?
Yes, we can.
Okay. Hello, everyone, and good day to you all. Today, I'm very happy to present EMPHNET's electronic library, which was recently launched in May 11. In my presentation, I will try my best to be brief and at the same time cover everything about EEL. As a start, I would like to talk about why did EMPHNET launch an electronic library? Well, as part of its strategic plan, EMPHNET is committed to developing new solutions and building on existing ones that enable and support field epidemiology training program residents and graduates and public health professionals in the Eastern Mediterranean region. EEL serves as a resource for public health professionals and field epidemiologists in the EMR and beyond. It provides its users with access to resources and tools that will advance their research and their practice. It also spreads public health education and information across the region, and it contributes to bridging the information to action gap. EEL's target audience EEL targets FETP residents, graduates, and teams in general. It also targets field epidemiologists and public health professionals in the region, as well as students and anyone interested in field epidemiology and public health. EEL's mission statement is to improve public health practice and research by providing access to information. Our vision, or EEL's vision, is to be the most comprehensive resource hub in the Eastern Mediterranean region, serving field epidemiologists and public health professionals. So now I'm just going to give you a quick glimpse on the services and features that EEL offers. In EEL, we have a section dedicated to documents published by EMPHNET and its partners. These include guidelines, manuals, webinar briefs, reports, abstracts, and other literature that is not published in journals. It is unique content that is now made open to EEL's users to benefit from. So far, we have more than 150 documents on publication. They are organized based on subject. Subjects include NCDs, infectious diseases, environmental health, nutrition, occupational health, and mass gathering. It is also worth noting that we have recently published a technical guide on mass gathering that you can find on EEL. EEL also offers its users a wide selection of resources, such as databases, ebooks, e-journals, and more. These shown on the screen are a sample of what we currently have, and it is important to note that the collection is a work in progress. We are adding resources frequently. We are also having, or we currently have some trials. At the meantime, we have Midline Complete, which is a database for e-journals. It contains more than 1,000 e-journals from different publishers. We also have Dynamid, which is an electronic evidence-based primary care database. We have CINAHL Complete, an e-journal database, where it contains a wide array of health science journals. And we also have EBSCO Books, which contains or offers professionals and students unlimited and anytime access to essential healthcare books. Going forward, we plan to add more trials and more resources to the library. We also have a request a resource form available for users, where users can fill up the form if they want a certain resource, such as an article, an ebook, or an e-journal, and all requests will be considered. Not all requests would be approved or would be available, but we will try our best. This form will also help us, EMPHNET and EEL, to determine the needs of our users and help in expanding our collection. So now I'm just going to take you on a tour and show you EEL's portal that you can access through library.emphnet.net. Let me just stop sharing my screen and then reshare my screen. Can you see my screen? Okay, so so this is our homepage. We have on it a federated search or a search engine, which is the content discovery search. It shows results from inside the library and also open access resources from outside. We also have a section for EMPHNET publications, which I previously talked about. We also have a section on tutorials, videos, and documents on how to use some resources available in EEL. And we also have a section for news and announcements of EMPHNET. You can access it right here. And then if we go up, the About Us page, you can learn more about EEL, its mission, its vision. This is it. Resources page. It contains all the resources that EEL offers. We have databases, we have ebooks, and we have e-journals available as well from different publishers. And we have some open resources available as well. And here you can see our trials. Here is also the request a resource form that I previously talked about. You can fill it in and submit, and we will work towards finding the thing that you have requested. Here is EMPHNET's publications. This page contains documents and publications produced and published by EMPHNET in collaboration with partners. These documents include, as I previously mentioned, reports, webinar briefs, abstracts, and so on. If you need any help, of course, you can contact support, or you can email eel@emphnet.net. We also provided a link to EMPHNET's learning management system, which is an online portal targeting health professionals and students. The platform offers free and self-paced courses and in Arabic and English, and award certificates of completion upon completing the course. You can check it out right here. I'm gonna copy and paste the links in the chat, so if anyone wants to check them out. And this is all from my side. I hope that was a brief introduction to EMPHNET's library. Thank you.
Thank you, Ms. Miral, for this very, very informative presentation. And on this occasion, I want to thank you all for these insightful presentations you shared with us today. You really inspired us to think more and to come up with more ideas. We have come to the end of the first part of our webinar, which is the presentation part. And now I hand the floor over back to Dr. Faris Salami, who will be handling the Q&A and concluding the session. Dr. Faris, the floor is yours.
Thank you, Donna, and thank you so much for the great presentations that we have today. In fact, you really widened the horizon of the subject, and the new prospects have been come to the mind, and a lot of questions. Again, I think is going to be raised after this these presentations. Really, it seems just like again, just like a cycle for generation of the information, organization of the information, then transfer and the application. And again, the cycle will start again by asking new questions after the application and so on. So there will be great role really for organization of the information, which I think is the main part of this session, with all the new dimensions that the eSphere had kind. In fact, only I think 11 minutes have been left, unfortunately, for the Q&As. So we are going to address just a few questions that had been raised. Number one had been raised by our colleague, Dr. Youssef, about the cost that many journals, unfortunately, ask authors to pay. I think, is it ethical really to have such a huge amount, which is many times, and I think this is also shared by some sort with another colleague as well for the same issue. Sometimes researchers from underprivileged countries, and they don't have the capacity to pay a huge amount of money. Meanwhile, I think this can create a sort of bias where researchers from rich institutes, they can go and share and publish in the outstanding, very reputable, highly cited journals, while other researchers from developing countries, for example, with limited resources, they don't have this opportunity to pay this amount. And that's why this is going to create this cycle. Rich go to rich and poor go to poor. And after that, the real sharing of knowledge cannot be achieved. So how can we think about this issue? And I will direct this question to Dr. Najib and to Dr. Ola later.
Thank you very much indeed. Yeah, the topic of ethics is one that is very tricky, because what is ethical in one place is not ethical in another, and what is accepted in one place is not accepted in the other. In what we are trying to do actually with knowledge exchange, knowledge sharing, is to improve equity, to improve access to health information. Because when we talk about global health, when we talk about the health of the people, we are talking about actually the well-being of that. These sustainable development goals, goal number 3 is talking about health and well-being. Now, health is hampered, is stopped, is killed actually, and that is what HIFA has always been saying. Many people are killed just because of lack of information. People die because of lack of information. We don't want people to die because they cannot afford to publish, or they cannot afford to access information. What we see actually, and I'm a very big promoter of open access and open repository, institutional repository. What we are saying actually is that the authors from the developing countries should not really pay. And there are many journals actually that do not charge for the article processing charges. They do charge the developed countries, they do charge the big institutions. And now it has become a tradition actually for the last probably 15 years. It has become tradition by which that if you do a research on behalf of a funding agency, then you are obliged. It's an obligation that you publish open access, because open access is the only way actually to ensure that people all over the world have access to the knowledge and they can use it. Very few libraries, and in our region at least, apart from the GCC countries, the 6 countries. Apart from them, none of them actually can subscribe to the full-fledged suite of journals. Even in Lebanon, where the American University of Beirut, where our colleague Dr. Ola works, when in Pakistan, where is the Aga Khan University is located and works. The idea is actually that Lebanon and Pakistan and many other countries, of course, apart from the GCC countries, they cannot afford to make subscriptions to the journals, which means actually that people of Lebanon, people of Pakistan, people of Afghanistan and Jordan and Syria and the rest of it, their health is being affected negatively because of lack of access to knowledge. And the best way to improve health is to improve access to knowledge. And what we see actually is the ethical way of, and the right way of accessing knowledge is through open access. Now there are institutions that charge for open access. Of course, there is money to be made. But let me confirm on the air that the Jordanian company that is headed by Hindawi, and now it is sold to another company. It was the #1 maker of money when they were publishing open access. Why? Because of the charges that they are paid by people. So it's not actually that they do not charge. They do charge. What we are saying actually is that they should not charge. They should limit the charges to maybe less than $100, and that should not be paid by the author. Dr. Khadr, Dr. Youssef mentioned actually that if somebody is publishing 20 articles a year and is asked to pay 20,000 or 2,000 per article, that is too much for one individual. The library of that institution should really be the influential part in making sure that the charges are
this depends on the
minimum
policy of the country, Dr. Najibi, as you know. In my country, for example, they don't pay for anything for publication. It is totally from the pocket of the researcher, which unfortunately, again, the issue of how to pay such amount of money, for example, in Iraq or in Yemen or in Sudan and Somalia, it is very, very, very difficult.
That should not be accepted, because the vicious cycle will continue. It will be impossible to break that cycle. I cannot access knowledge. I cannot produce knowledge because I cannot afford to access the knowledge. I cannot afford to publish my own experience. And then there is like two words of existence: one that is rich, and the one that have, and the one that does not have. The have-nots, the haves and the have-nots. And this is not acceptable. What is acceptable is actually to make sure that people who do not have the money, but they need the knowledge, they should really have access to that. And that's why programs like Hinari, like Agora, like others are being there. But let me assure you, the publishing industry is one of the very flourishing industry because of this manipulation of people actually wanting to have access to knowledge and knowledge sharing. They don't want to.
I'm sorry to interrupt, but we have only 4 minutes really.
Go ahead.
And sorry
for
that.
I can speak.
Very quick. Yeah, I can appreciate and I can feel your enthusiasm in this area.
I can speak forever on that because it's touching my own.
Exactly, I can feel that.
Yeah.
Just very quick response really from Dr. Ola. Can people from outside the EUB subscribe to your library? Is it possible?
What do you mean by subscribe? Do you mean to visit? Do you mean to access online collections?
Yeah,
so
to access and to have resources from your library. Is it possible?
Anything which is open, a lot of things which are open for free. Yes, anyone can do that. Other things which are by subscription, again, and we pay for them, definitely we're not allowed to share them because it depends on the number of users.
Yeah, this is again the same issue. One last point, please, if you can put the website or the link for your one-stop shop of COVID-19.
Okay. Yeah,
this will be very useful. One quick question, really, for the Alice and Ray. What do you think about the future of the classic libraries that we used to really enjoy years ago? What can happen after this engagement in the e-sphere?
Well, I guess it's an interesting question, because everybody is like, what will happen with the regular library? I believe that the digital libraries will not replace the physical library. It's not something that a digital sphere will replace the physical sphere. We saw it in COVID before libraries, that our interaction as a human being, we tried our best to have it online, but at the end of the pandemic, everybody wants like to connect face to face with people and have that interaction. So there's the human element, which is a very important element within that interaction. And I believe that's a cornerstone for physical libraries to be there. In addition, the services that can be added that we've mentioned in our presentation for the digital library. So no, Alice, if you have.
Yeah, also for us, we cannot like only a digital library, because we used to use the, as a cancer center, there is a book that really they want to read, not only, digital. This is what our, user also, they ask. This is what we did, we have, something online and the other it's not online, because this is, it's easy for them also to distribute for the, even for what we have now, students, and also for the doctors, that they can read and distribute it to the doctors, because even online there's not everything they will find it on it. For something like for us, as something like what I mean, books, it's really, and with the question and answer, yeah, maybe if I don't want to say, or to mention what's the books that they need it like as a paper. I don't want to publish, this one. Okay.
Thank you so much. Again, I think this is the same issue can be applied not only for the libraries, but even for the whole academic institutions. What can happen after all the information are now available in YouTube and different forms of PowerPoints, etc., etc.
Yeah,
so everything is now available online.
Yeah, I know, but some they, even university. I noticed that some, all the students are like to read more than, especially the old also, maybe the new generation, they used to use the online, but the one before, like we like to read also. Still,
and there's one more also element, which is, the role of the library in engaging with the communities. So it's a very important also part. This is where can library also flourish within their communities, even whether it's an academic or non-academic libraries. It's a very important role also for the libraries. And I believe we can see a lot of models happening now where the library is engaging more with the communities. So the role may be changing, but it will not. The digital libraries will not eliminate the role of the physical library.
Yeah, that's absolutely. Thank you. And really, Mara, thank you so much for this presentation of the EEL, Infinite Electronic Library, and particularly this issue regarding the request a resource. Really, this is a very good service that you can provide for the colleagues in the FETPs and other users of this library. And what type of requests that you receive by now?
Well, we received some requests regarding some articles, regarding a manual, and thankfully we were able to like fulfill these requests. And but it's kind of tricky to find them, but so far we've been able to.
Thank you so much. And I encourage every one of our colleagues to subscribe and to have a look and to see what are the services that the Infinite Electronic Library can provide to our colleagues. One issue that I would like to highlight about, or to talk with you really about, that's particularly true after the pandemic. There's huge amount of information, huge amount of articles, and as you know, the word infodemic become more frequently used by everybody because of such a huge amount of information that really overwhelm us, and while we are chasing really for finding the true among the huge amount of some of them, they unfortunately not necessarily to be true. With this huge amount also of the preprint that are sometimes they attract the attention of the journals, of the media, of the other person without being peer reviewed, which is again create a lot of problems. Really, I think inside each country, and my country, for example, we face a lot of problems with some of the professionals because they are relying on what have been published as preprint, although they are not finalized or they are not peer reviewed to be considered. So about the issue of the predatory journals and the preprint. Dr. Ola, probably I would like to have your opinions about these issues, about the predatory journals and how common they are, and about the role of preprint and how much they are really useful in this area.
Yeah, thank you, Dr. Faris. You touched up on what stinches my heart a lot. So the word fake news and infodemic, they really touch, especially when it comes to health, because we're paying really a high cost, which is sometimes the lives of patients. So we're currently working on a lot of projects internationally to tackle misinformation and disinformation and all that. Coming to predatory journals, I would say maybe there comes no day where I don't receive a request from a faculty or from a colleague checking this journal, is it predatory or not? Because a lot of them, unfortunately, has been felt under the trap of predatory journals. They try to trap the very good figures and researchers in the field, and there are a lot of signs. So what we're trying to do is to raise awareness about what signs you can check in order to know whether this journal is predatory or not. So they try to tell you, like, we're really very interested in your research, you're a pillar, you're a figure, and all that to get you to, and they even make you pay money. So it's not free, because sometimes there's a misconception for some researchers, which I know, and I try to correct, that everything which is free is not good and everything which is paid is good. So whenever you're paying for a journal, this means that it's good and it's a high impact journal. But no, predatory journals are also trapping a lot of us as researchers, as librarians, and they're asking for money. And then this is like a dark spot in your CV as a researcher to have published in a predatory journal. So we try to raise awareness. I think awareness and advocacy and getting to tell people, because if you don't spread information, no one would know. What is a predatory journal? What do they do? How do they get how do we get to know that this is a predatory? So there is a lot of criteria that I try to share, to check for, to judge whether this journal is predatory or not. Excuse me, what was the second thing you wanted me to comment?
No, that's fine. That's fine. Thank you so much.
I did that.
Yeah, you did. Thank you so much.
You.
And really, this is a message for the young colleagues and the FETP residents and the young newly graduated FETPs. I think not to jump and to publish everywhere, because many times we receive, particularly after conferences, we receive a lot of emails asking us to publish, but unfortunately I can see that many of them they are predatory, and one should be very cautious and very critical in selecting the journal where to publish and to go. Sorry, go ahead.
Just one thing, there are also predatory conferences, so please also don't get trapped into them. These are also emerging nowadays. We are having predatory conferences, unfortunately.
Exactly. One last issue really I would like to highlight, because again we are facing this a lot many times in our practice, is this electronic sphere really had made information available for all, even for the general public. And many times this is really a two-sided issue. Sometimes because they can't get use of the available information and use it in a proper way. But meanwhile, sometimes these technical information for the general public can be very risky again, and particularly when they come to physicians and become discussing the treatment as if they are very professionals. Dr. Najib, I'm sure you heard about these issues. So what do you think about that? You are muted, Dr. Najib, sorry. Still muted. Yes, please.
Sorry again. What is called knowledge translation it has an aspect of actually translating knowledge that is complicated, that is using a lot of jargons into knowledge that people can understand, can absorb. And this is in health, at least, is really important, because doctors and nurses in hospitals, in clinics, in healthcare centers, they do use information that is not understandable. Now, we do not assume that the doctor, the clinician, the author, the researcher is at the same level as the ordinary man. And this is where actually it's really important to have a group of people, whether they are scientists or editors or journalists, to understand both the technical language that is so complicated, to translate it into a language that is understandable by people. And there are a number of institutions and there are a number of organizations actually that are working in this particular area, by which their concern is knowledge translation of knowledge that comes in articles, in scientific and technical papers, into a language that understood by the public and is understood by the policy maker and by the decision maker. We don't assume at all that the policy maker does have the time, or the public has the skills and the time to read the technical terminology and to read these complicated papers. And that's where actually it's really important to create a generation. And I really hope that EMPHNET will pay attention to this particular thing. How can we translate public health terminology and concepts and articles and studies into a language that many people, the normal people, the ordinary people, the policymaker and the decision maker can actually understand and then can develop. And that's where policy briefs, and that's where certain actually NGOs are focusing their attention. Thank you for the question anyway.
Thank you so much, Dr. Najib, for this really very nicely you put it. Thank you so much. And really we are reaching exactly to 7 p.m. at Amman time. So I would like to thank our distinguished speakers, Dr. Najib, Dr. Ola, Ms. Alice, Ghait, and Maral. Thank you so much for your great presentation indeed. And thank you to our colleagues and the friends who joined us this important webinar. And thank you so much, Dana, for co-facilitating this webinar. And again, thanks a lot for the colleagues who are beyond the scene and doing a lot of work in order to keep things in the right track. Thank you so much, and hopefully we will see you again in another webinar tackling another important subject just like this one. Have a good day. Thank you. Bye-bye.